Welcome to our mnemonic video on Paget's disease of the bone. Let's get started. This story takes place on the opening night of an art exhibit running a little behind schedule. As the guests start lining up, we can see that an artist named Ed has been called to fix his mosaic painting. If you look closely, you can see that he's holding a pager in his left hand that notified him with this urgent painting maintenance. Well, pager sounds like Paget, which should remind you that this story is all about Paget's disease of the bone. Paget's disease of the bone is a slowly progressive disease of increased and disorganized bone turnover. Normally, bone is laid down in a lamellar pattern. However, in Paget's disease, the bone becomes a mosaic of woven and laminar patterns with increased vascularity and fibrous tissue in the marrow. This mosaic pattern of the bone is depicted by Ed's mosaic painting on the wall. The structural irregularities result in a bone that is much weaker than usual. Now let's learn about the signs and symptoms of Paget's disease. Ed is panicking because someone accidentally damaged the top portion of his artwork right before the opening of the exhibit. Comparing the painted face to Ed's face, maybe the painting is a bit of a self-portrait. The piece seems to reflect the panic of the artist as he stares at his crumbling artwork. The word panic represents the acronym PANICS, which is used to identify the symptoms and signs seen in Paget's disease of the bone. PANICS stands for pain, arthralgia, nerve compression and neural deafness, increased bone density, cardiac failure, skull involvement, and sclerotic vertebrae. Most cases of Paget's disease are asymptomatic. However, if symptomatic, any of these features can be expected. Bone pain will present with redness and warmth overlying the affected bones due to increased blood flow to the areas of bone turnover. Affected bones can also present with pathological fractures and deformities, like bowing of the legs. Enlargement of the skull can cause headache, an increase in hat size, compression of the cranial nerves, and involvement of the ossicles that lead to deafness. We can see some of these features here, like the blue shoes and hat that are far too small for Ed's body. If you noticed, his hat barely covers any part of his scalp, and his large toes have broken apart the front of his shoes. All right, now let's discuss the diagnosis of Paget's disease of the bone. Above the first painting is a framed radiograph of someone's hands. Notice that this framed radiograph presents as Paget's disease does, with areas that are both radiolucent and radioopaque. The pattern reflects the lytic and sclerotic processes of the disease. A plain film X-ray is a good first test to determine whether Paget's is present or not. In general, X-rays will show cortical thickening, leading to radioopaque areas along the border of the bones. In the skull, this is called a cotton wool appearance, and in the vertebral bodies, it's called picture frame appearance. Now let's take a look at the painting next to it. It has a black and white skeleton and areas of light and dark bone. Notice that Ed has left his signature symbol, a yellow circle with black triangles, which looks very similar to a radioactive sign, and we can see this in the lower left part of the painting. This painting represents the radionuclide bone scan, also known as bone scintigraphy, which uses radioactive material to pick up abnormal bone formation and deposition. Note that the painting shows very localized spots of increased uptake in the bone. Paget's disease tends to localize particularly to the head, pelvis, or long bones of the leg, and this localization helps differentiate it from other more systemic bone conditions like osteopetrosis. Imaging with a bone scan can help ascertain both the sites and extent of the disease. Now let's meet our next artist, who has finished one painting of the scenic Alps, which is seen above, and we can now see her working to complete her abstract below, which is a painting of a neon flower next to a jug of milk. These paintings will help us learn about the lab values in Paget's disease of the bone. The Alps mountain range is spelled ALP, which is why we chose them to be our recurring symbol for alkaline phosphatase, since it can be abbreviated ALP as well. The jug of milk is our symbol for calcium, and the neon flower shaped like the chemical structure of a phosphate group symbolizes phosphate. The painting of the Alps is hanging at the top of the room to represent the elevated levels of alkaline phosphatase in Paget's disease of the bone. Remember, the pathophysiology of Paget's disease involves increased rank ligand activity, increasing osteoclast activity, which triggers osteoblast activity. Osteoblasts produce alkaline phosphatase as an expression of their activity. So in Paget's disease, where they are hyperactive, lab values will show an elevated level of alkaline phosphatase. In turn, the painting with milk and neon flower hanging at eye level represent normal levels of calcium and phosphate, and this helps differentiate Paget's disease from the high levels of calcium found in metastatic bone disease. Now let's learn about the management and treatment of Paget's disease of the bone, which will be illustrated on the left portion of the image. There is a charity event raising funds for starving artists, so there is a neon sign that says "Donate" on a donation box set up near the entrance of the museum. Donate sounds like dronate, the suffix of bisphosphonate drugs, such as alendronate and risdronate. If you noticed, the upward arrow indicates a rise, which when added to donate will remind you of risdronate. Anyways, while there is no cure for Paget's disease of the bone, bisphosphonates are the first-line treatment for symptomatic disease. They work by binding hydroxyapatite in bones and inhibiting osteoclast function to slow down the rate of bone turnover. One of the most well-known side effects of bisphosphonates is esophagitis. Therefore, it's important to remain upright for at least 30 minutes after bisphosphonate ingestion in order to decrease the risk of esophagitis. Let's look at this next piece of art. It's a piece of chalk chiseled into the shape of a musical tone. Chalk is formed from calcium salts and should remind us of calcium. If we put calcium and tone together, we get calcitone or calcitonin, which is a hormonal drug used in Paget's disease. Recall that the pathophysiology of Paget's involves the overactivity of osteoclasts and osteoblasts. In its lytic stage, osteoclasts digest the bone and release calcium and phosphate into the blood. High levels of calcium in the blood can result in bone pain, kidney stones, abdominal pain, constipation, and altered mental status, or the otherwise well-known mnemonic bone, stones, moans, and psychiatric overtones. Calcitonin directly prevents this function of osteoclasts and prevents absorption and reabsorption of calcium and phosphate by acting on the bowel and kidneys to treat the symptoms of hypercalcemia that may arise during the disease process. In the middle of the room, we have a super cool modern art piece of a milk cartoon. Milk is our reoccurring symbol for calcium and should remind you to supplement the patients with calcium to correct hypocalcemia before starting the patient on bisphosphonate therapy. As the bisphosphonates decrease the rate of bone turnover, the bone begins to repair and heal itself and requires calcium to do so. To support the healing process, maintaining an adequate level of calcium in the body with calcium supplements is recommended. Hanging above the framed calcitone is a beautiful painting of a sunset. The sun is an important source of vitamin D and should remind you to correct low levels of vitamin D before starting bisphosphonate therapy. Vitamin D helps to increase calcium absorption and reabsorption through the gut and kidneys, so supplementation is recommended to support adequate levels of calcium. As the artists scramble to set up their paintings, the first guest of the night walks in through the door. As you can see, this person has a pair of crutches, and a museum attendant is helping the individual walk around and look at the art. Because of the effect of Paget's disease on the bone, mobility may become impaired in some patients. Like this museum attendant, physical therapists and occupational therapists can provide beneficial adjunctive treatment to increase the quality of life in someone living with Paget's disease of the bone. Now let's meet our final artist, who is finishing up swirling the colors of his abstract painting. He is holding a scalpel-shaped brush, which he is using to drag red paint around the canvas. The scalpel should remind you of surgery, which may be required in the case of fractures, severe deformities, and osteoarthritis refractory to medical management. And with that, we've covered everything you need to know about the pathophysiology, symptoms, diagnosis, and treatment of Paget disease of the bone.